Good morning, ladies and gentlemen. Uh, the topic is to correlate fatty liver changes with corneal endothelial parameters in patients with alcohol dependence syndrome. This is our recently published literature from our institute, where we have shown that it's for the first time it has been reported that there are corneal endothelial alterations in patients with alcohol dependence syndrome. So while on working with this study, the patients, when we found that had corneal endothelial disorders, so we all know that alcohol dependent syndrome patients have also affection of various organs, especially liver, and there are different stages of liver, and since the alcohol dependence syndrome is affecting both the corneal endothelium and a very well published literature related to the various stages of liver, so the purpose is whether corneal endothelial parameters differ in different stages of fatty liver. That is what is the question of this study. So we took 161 alcohol dependent syndrome patients from our psychiatry department. All of them firstly were subjected to the specular microscopic examination, in which the endothelial parameters in terms of central corneal thickness, endothelial cell density, coefficient of variation and percentage hexagonality was assessed. And we measured the endothelial parameters of both the cornea. However, we have included, as per statistician advice, for CCT and CV the higher values were taken, and for endothelial CD and percentage hexagonality the lower values were taken between the two eyes. ImageNet software that is already incorporated in the specular microscope that was used, and the same operator captures the 3 images of each cornea at the same time of the day, and an average was taken for each endothelial parameters, and this average was then subjected to the analysis. Now the second part is the fatty liver. So an expert radiologist from our institute did the assessment of the liver in all these patients, and he categorize them into one of these 4 stages of fatty liver. And then, like stage 1 has normal liver echogenicity, stage 2 there is increased liver echogenicity, stage 3 is echogenic liver obscuring the echogenic wall of portal venous branches, and stage 4 is diaphragmatic outline when it is obscured, that's come under the purview of stage 4. So for comparison of the stages of fatty liver with endothelial parameters, the Kruskal-Wallis test was used. So what we found in the result is that when the different stages were compared using Kruskal-Wallis test, we could find that the central corneal thickness and endothelial cell density differs amongst the different stages. But if we look into between the 2 stages, of course we have to do the Mann-Whitney test, and we found that in terms of CCT, there is a variation, statistical significant difference between grade 1 and grade 2, and also between grade 1 and grade 4. Now regarding the endothelial cell density, when we analyzed between the different stages, we found that there is a variation in stage 1 and 2, stage 1 and 3, also stage 2 and stage 3, and stage 4 and stage 4. So the current study shows that the patients with increasing stages of fatty liver exhibit more pronounced endothelial alteration, including CCT. Since we have not got any such literature available from PubMed and other part, so what we hypothesized is that since the alcohol dependence is affecting both corneal endothelium and fatty liver, and how we showed as per the literature that how the alcohol is affecting endothelium is by 2 experimental studies which are already there in the literature. One is The post-mortem blood and vitreous alcohol concentrations were compared in a series of 295 alcohol positive cases, whereas vitreous alcohol concentration exceeded blood alcohol concentration in about 71%. So if it is there, so similar expectation is there for the aqueous humor also. And secondly, we found that there's a drop in endothelial cell count in cornea stored in cultured media with acetaldehyde, which is one of the byproduct of the again alcohol. So similarly, if an alcohol affects the endothelium, there is a well-known literature that it affects even the liver, and that's how the two things is getting correlated in this study. So for the first time, we have provided data showing an increased corneal endothelial damage with an increase in stages of fatty liver. So word of cautions to all the cataract surgeons here, that when we operate on the patients with liver diseases or the patients who are alcohol dependents, we should be more concerned about the endothelium, especially when we are doing the intraocular procedures. Thank you.
Dr. Alok, I just want to know, there were age matching done for the different groups?
Age matching different groups, like you're talking about the stages of different.
Yeah.
Yes, it was done. It was statistically not significant.
No, because I'm just suspecting for the region from 2600 to 2400 is the difference between the endothelial cell count.
Yeah.
And the chronicity may be, or the disease may be because of the age or consumption years.
I agree with your point,
So
because age decides the endothelium.
Yeah.
That we all aware of. So in all these stages, sir, we have done the age matching also.
Okay. Because only 40-40 must be there in the each group.
Yeah.
So probably
That type of
this
statistical
data,
parameter was
you
done.
feel that the Kruskal-Wallis test you use is useful for this much a small number of patients to derive the data?
Sir, the statistician has guided us in this regard. Okay. Otherwise, if it would have followed the parametric data formulation, obviously the ANOVA would have been the ideal.
Anybody of the study patients have gone surgery subsequently?
No, sir,
surgery or
that
something?
we have not done, sir.
Because I still suspect that having this much difference will make really clinically significant thing.
Yeah,
And that too in patients who are having a definite liver disease from the alcohol. So probably the consumption must be very high, and still the difference is looking like not a very big number. But statistics that
this
is
is
a
one
difference.
step ahead, sir. I think this is first published literature in BGO recently, sir. So hopefully it will come out. First published. No one studied it before, sir.
Only one factor, ethanol is responsible for toxicity of the endothelium. Do you think any other factor?
Sir?
Any other factor which contributes this endothelial changes?
There are multiple other factors also.
What are those?
One is hypovitaminosis, one is hypoglycemia, because these chronic alcoholic patients, they are, they don't take food properly. So even hypoglycemia has been considered as one of the factors. Hypovitaminosis, especially B1 level, if it is less in aqueous humor, that is again has been suggested.
How the vitamins affects the endothelium? You told the hypovitaminosis.
Hypovitaminosis.
How?
So they may be, they affect actually the those gates which like sodium potassium channels and all that.
That is another factor, not related with sodium potassium. So that's another factor.
Okay.
But I know there's some literature is available in that particular. You have told that is only this no literature available in this study, but I know some other literature are also available.
Regarding this analysis
regarding
is not there, but
thickness.
People have studied the affection of, say, vitamins on endothelium, that too only the experimental studies, not in the patients.
Thank you.